Hello, wonderful people. Today, we'll be taking another section that is multiple choice questions in community health studies. So, I urge you to stay calm and take this section. Try your ability before the council exam. Primary health care in Nigeria collects health statistics from various sources to monitor and improve public health outcomes, which does not include A, National Health Management Information System, B, Disease Surveillance and Notification System, C, Vital Deregistration System, D, Demographic and Health Surveys. The correct answer is C, Vital Deregistration System. This is not a recognized data source. So what this question actually asks was the sources of health statistics for Nigerian primary healthcare system. And all that was mentioned, the National Health Management Information System, Disease Surveillance and Notification System, Demographic and Health Survey were all sources for the primary healthcare health statistics. One is a cause to the variation in pulse rate. A, volume, B, rhythm, C, moderate pressure, and D, position of the patient. The correct answer is D, position of the patient. Recall, body positions such as sitting, standing can affect pulse rate and including blood pressure. The term adenasa, used in describing female reproductive system, is used for the following. A, uterus and fallopian tube. B, ovaries and uterus. C, ovaries and fallopian tubes. D, vagina and uterus. The correct answer is C, ovaries and fallopian tubes. These are the accessory structures of the uterus. So adenasa is actually used for accessory structures of the female reproductive system. A vaccine carrier has a lifespan of A, 48 hours, B, 24 hours, C, 26 hours, D, 12 hours. The correct answer is B, 24 hours. Most standard vaccine carriers can maintain temperature for vaccines for up to 24 hours. Recall that vaccine carriers are loaded with ice packs. So most ice packs are meant to stay for 24 hours before they lose the ability to maintain the cold system. One of these is not a hormone secreted during pregnancy. A, human chronic gonadotropin. B, oxytocin. C, thyroxine and thyroxine. D, lactogen. The correct answer is C, thyroxine and thyroxine. These are thyroid hormones and are not really specific during pregnancy. Like all the hormones that we have mentioned, like the HCG, oxytocin, and lactogen, are primary hormones we are aware of in the pregnancy cycle. The lactogen responsible for the mammary gland, the oxytocin, the human chronic gonadotropin are all we know very much about pregnancies. But the thyroxine that and the other brother that is being secreted by the thyroid gland has a role to play in growth and development and in other metabolic processes. But the above ones, the human chorionic gonadotrophin, oxytocin, and lactogen had specific role during pregnancy. A 42-year-old woman who has a problem during the vision testing due to the decrease in the power of the accommodation suffers from which of the following conditions? A, presbyopia, B, phoria, C, tropia, D, strabismus. The correct answer is presbyopia. What is presbyopia? It is an age-related loss of the eye's ability to focus on near object. It has to do with the refractive errors, the lens. The vaginal fluid is strongly acidic with what pH? A, 3.5, B, 4.5, C, 5.5, and D, 6.5. The correct answer is B, 4.5. Normal vaginal environment is acidic in order to prevent infections. One is a cause to the variation in pulse. A, the volume of the pulse, B, the rhythm, C, the moderate pressure, D, position. And the correct answer is D, position of the patient. A change that occurs in behavior and attitude of a pregnant woman due to hormonal fluctuations is referred to A, social changes, B, physiological changes, C, pathophysiological changes, D, psychological changes. The correct answer is D, psychological changes. Hormones can affect emotions and mental states of a woman that is pregnant. One of the following is not a deficiency of vitamin A. A, xerophthalmia, B, keratomalacia, C, esophathalamus, D, calciferol. The correct answer is D, calciferol. Calciferol is also known as vitamin D. So when you look at the options provided, one of the following is not a deficiency of vitamin A. Xerophthalmia is there, keratomalacia is there, esophathalamus is there, whereas calciferol is the wrong option. The enlargement of the spleen is also known as A, big spleen, B, splenitis, C, splenitis, and D, splenomegaly. The correct answer is D, splenomegaly. Splenomegaly is a medical term for an enlarged spleen. Thank you. I hope you find this section very interesting. Do well to subscribe, follow, like, and comment, and also share so that others can benefit from the little test of knowledge. Thank you. See you in my next video.